Hey everyone, you may have seen my page with some back and forth with a buddy of mine named Mark on health insurance. And it's not just him or anybody else on the right, or even some people on the left, really, that I don't think are framing this issue properly. So that's why I think it's so contentious. I think right now, where we are as a country, is there's this belief that we move to Medicare for all, like Bernie wants to do, and then you lose the health insurance you have now, and that's about it. That's where I think the debate is framed. I don't think there's a whole lot of information in the middle that explains, let's say, a Democrat like myself's reason that I don't like the system we have. So let's start with looking at what we've got. What we have right now is healthcare that is subsidized, or let's, for a better word, let's use supported by or funded by your company. I just went to Blue Cross Blue Shield and built myself a healthcare plan with a $1,800 a year deductible, decent drug coverage, and the number that I got or was quoted was $587 a month. So if I spend $587 a month to Blue Cross Blue Shield, then for an entire calendar year, January 1 to December 31, I'm only responsible for that $1,800 deductible. And then the health insurance company picks up the rest or most of. And generally, if it's most of, it's 80 to 90%, depending on what procedure or what it is. And right now, the argument the left has is if you are working for a small business that does not provide company subsidized health insurance, if you are unemployed, or if you are underemployed, meaning like part-time, where almost all companies only offer health insurance subsidies to full-time employees, then you are left without health insurance. And then what happens is you go into a hospital or an emergency room and you have something done, and then you never pay for it. And the insurance companies argue that that's why prices are going up. To dispel a myth here, nobody is blaming the Affordable Care Act in the insurance or drug world. Nobody. The only people who do that are Republicans, and I'm just being honest about it because that's the way it is. Long before Obamacare, this issue where most hospitals have a mandate that they turn no one away, have said repeatedly that taking care of people who do not have health insurance is the biggest reason that rates are going up. So think about it like this for a minute. When I lived in Kentucky, my homeowner's insurance for the year was $494. In Oklahoma, it was almost $3,000. The difference is I am in the middle of Tornado Alley. I am somewhere where a large loss is more than likely to occur, so I spend more money out of pocket, okay? So we're talking about a system now that is dictated based almost entirely on employment. There are two government systems, Medicare and Medicaid, and most people don't even know what the hell those two are. Medicare is meant to be your in-retirement insurance. Medicaid is more for poor people or people who don't have enough money or who fall below the poverty limit, and where they get government subsidies to help their health care like you do at your full-time job. I know that's a very, very shallow explanation of what those two systems are, but if we dive too deep in the weeds, we don't address what I want to address, which is what I think to be the real issue. So in America today, you get hired on at a company and they provide you a packet that gives you a few different alternatives on healthcare. They all kind of follow the same rule. The more money that comes out of your check, the less you pay per year in a deductible, okay? And that's just kind of the way it works. And your insurance company, the easiest way to describe the way an insurance company works is they make their money on what's called a float. Float is the difference between the money that comes into them every month and then the money that goes out every month. So whether you're a health insurer, a home insurer, an auto insurer, a motorcycle insurer, business insurance, medical malpractice, whatever the insurance is, the money they bring in every month, they want that to be more than what they send out in claims. And then that amount of money there is called the float. And generally that money is earning interest on short-term things like government bonds, and the insurance company wants to continue to bring in more than it pays out. And that is how they make their money and earn their profits and all that. And most of them are publicly traded companies. You can go buy stock in them. United Healthcare is a big one. Blue Cross Blue Shield, Aetna, which is AETNA, is another big one. Humana. These are big, big, massive companies. And the goal of the company is to bring in more in monthly premiums than it spends out on claims, okay? And this is true of all insurance companies, not just healthcare, but all of them. So you have that one aspect there working where insurance companies are incentivized to not pay, okay? We'll get into that later. The second thing is making it a condition of employment. Now, let's say that I go out and I start a small business and it's going well, and I decide to go out and hire 2 or 3 people because I can't do all the work. I go out and hire those 2 or 3 people, but the way it works is when I pulled up my quote earlier on Blue Cross Blue Shield, out of that $587, I knew Mark was going to join this. Out of that $587, many Fortune 500 companies are covering most of that $587 for me because I work there. Now, I've got Travis Incorporated. I need to hire 2 or 3 people. But if I don't have the money to spend on their health insurance, then I would just simply not offer a plan. Now, this is where the Affordable Care Act came in, and it's got its flaws, believe me. I can go all day on that. But what it said was this: we want to set up a market or an exchange, just like a stock market, where healthcare companies can put plans on there. And then consumers can go out and look at those plans and then pick the one they want. And the thought was, if Aetna and Blue Cross Blue Shield and Humana and all these other companies were on that exchange, it would drive prices down due to competition. Generally speaking, your company will only offer a couple or 3 health insurance plans, and a lot of times they're only from the same healthcare provider. When I worked at AT&T, we had 2 plan options, but they were both from the same healthcare provider, so I didn't have a whole lot of choice there. So what this was meant to do was take down some state regulations that bar insurance companies from competing in certain areas. And again, we're not going to get in the weeds. This is a high-level overview. Obamacare was meant to take away those barriers and allow all insurance companies in every state to have an exchange in which consumers could go look at, and then the healthcare companies were saying, oh, well, shit, Humana just put out a better plan than mine, so I need to be competitive. So Blue Cross Blue Shield made their rates more competitive and their coverage is better and things like that. Of all the ironies, one of the states that did this the best and got a lot of props for it was actually my home state of Kentucky. They embraced it very early on, and they had very competitive rates that were better than a lot in the nation. So what are we on the left wanting to do? What we are wanting to do is break the inside of the system. Right now, the debate is framed as, I want my company paid health care versus I want free health care. And then the people who have company paid health care don't want to give that up. And then you have uninsured over here who want it. So the debate is being framed as, if we do Medicare for all, those of you who have insurance through work would lose all of that. And the goal of Medicare for all is to change a few things. Number one is, right now, you will get a login for your health insurance company, and you can go and look at a certain disease or a treatment or a specialty, and they will list for you the doctors that are in network. And if you don't have an in-network doctor, then your health insurance company says, we will charge you more. And what Medicare for All would do is it would let every doctor be in it. There would be nobody who is excluded. 92% of all doctors right now are already in the Medicare system. So we only need to bring on another 8% to start accepting Medicare. Now, the reason I think we need to do this is a couple of reasons. I talked to you all earlier about how most hospitals operate under a mandate of nobody gets turned away, whether they have health coverage or not. So if Bob Smith, who doesn't have health care, falls and breaks his wrist while cleaning his gutters and he goes into an emergency room, they are going to take the x-rays, they're going to set the cast for him, and they're going to give him some pain pills. And then Bob is never going to pay them back. Okay. He's going to be one of the hundreds of thousands of people that declare bankruptcy every year over medical debt. And he's just not going to pay for it because he doesn't have the means to. But Bob's not going to walk around with a broken wrist. So the insurance companies are saying, well, the hospital cost, insurance costs, drug costs are getting so much that we have to raise our rates. Now, corporate America, of course, is focused on profit, which is fine. We are in a capitalistic system. But what that means is that over time, when you see your healthcare costs going up, it's not really going up. The monthly number that is being charged year to year to the company for your policy doesn't really change. It's how much of that number your company is willing to pay for. And this problem goes all the way back towards the end of Clinton years in office, where medical costs started outstripping the rising cost of normal inflation by about tenfold. It started going up like crazy. And we went for a long, long time with this problem, but then everybody blamed it on Obamacare when it came out. But this problem existed long before that. And the reason is because your company is profit motivated. So if out of the quote I pulled up for myself earlier, if out of that 587, my company is paying for 487 of it, next year they may say, well, how many Travises could we say we're not going to give him 487 next year? We're going to give him 400. And then the cost out of my check goes from 100 to 187. None of that has anything to do with Obamacare or the Affordable Care Act. Those companies through the ACA got access to more customers on the exchange than they did hoping you worked for the employer that they had a contract with. It's your employer saying, well, I want more profit, and here's a big cost going out the door every 2 weeks where we are covering this for the employee, and we can just pay less. And then the employee sees their healthcare costs go up and doesn't understand why. So what Obamacare did, or the Affordable Care Act, is it made a marketplace where many insurance companies could all put their quotes on there, and then they could all see their quotes, and then they would have to fight each other on price to gain customers. So it was meant to be more competitive. Now, the Republicans tried to repeal Obamacare somewhere around 50 times under Obama. Did not work, and they tried with Trump. They tried with Trump and with the Republican House and Republican Senate. And the reason it failed was for people who worked for a small business or were part-time and couldn't get full-time or did not work at all, had purchased policies on the exchange and were now being covered. And if you say repeal and replace, there wasn't a system yet to replace it with. So they weren't necessarily saying F you to Trump and the Senate and the House. They were saying, I don't want to lose what I've got, because until the ACA existed, I had nothing. Now I have a plan, and if you're going to replace it, then that's cool. But if you're just going to repeal it with nothing on the table, then I am not going to vote you back into office. So when the votes went to the floor, Republicans peeled off and did not vote to repeal because they were worried that they might not get reelected if they kicked several thousand people in their district off of their ACA healthcare, okay? So this had nothing to do with where you work at as a company. It just was a very popular idea amongst people who did not have healthcare. Now, Obamacare, or the Affordable Care Act, is an old policy, okay? If any of you were alive long enough to remember that back in Clinton's first term in '92, Hillary Clinton, as first woman, set out to reform America's healthcare, and it went over like a turd in a punch bowl. It was god awful. It was not well received. The public hated it. And so Bob Dole ran on a policy that very much mirrored the Affordable Care Act, that said, hey, why don't we just create a marketplace, let all the insurance companies fight over price, and then they'll all undercut each other and consumers will come out better. And Obamacare is almost to the T that policy from 1996. Okay, it's a very, very old idea, and one that personally most Democrats didn't like. It was just the lesser of two evils. So the problem isn't we want to remove company health care and we want to go all government paid. There's a deeper element to this that I think we all miss because nobody, neither Democrat or Republican, are doing a good job of explaining to you how does the system we have work right now and where are its flaws. Flaw one is with your insurance company. Because they are a for-profit company, they are incentivized to not pay out on your claims. For example, when I broke my collarbone in 2014 or 15, I was on Verizon's health insurance and I had a max deductible for the year of $1,200, which I did end up paying. And then I received a bill for about $5,000, and it was because there was a medical coding error. So apparently, and I got to learn this the hard way, when doctors submit paperwork to your health insurance to get paid, they have to put medical codes on there. I don't know if those are numbers or letters or what, but I was told that my surgery had a couple of codes that were coded wrong. And I spent hours between my doctor, my orthopedic surgeon, and my health insurance company trying to figure out what needed to be changed so that that $5,000 was covered under my policy. So you have health insurance companies that are bringing in this money every month in their monthly premiums, but they are not incentivized to spend it out at all. They don't want to get it back. They want to hold on to as much as possible, okay? So, and this works true not just in health insurance. My car insurance had to cover where I hit a pothole in my Lexus and I broke pretty much everything on the inside of the passenger front wheel of my car. And when I finally paid for it, Geico had written me 9 checks because Geico said, do this first and see if it works. Lexus already told them, we have to change out everything inside that wheel. All the inner workings of the wheel, the brakes, the shocks, everything in there is just completely destroyed. But Geico made them do it one piece at a time because Geico wanted to spend as little money as possible. There's nothing wrong with that. But it just meant that when I went to Lexus, I had to literally endorse 7 different checks to Lexus. The problem with that in healthcare is sometimes there's not time to wait. You know, if you have diabetes, waiting for your insulin reimbursement doesn't really work. If you have a heart condition, waiting to get a pacemaker put in doesn't really work. So our argument is more with the internal design of the system where the insurance companies are trying their best to not pay you for what they owe you, and your company has no desire to keep paying what they pay for your healthcare every month, and they are allowed to keep scaling that money back as much as they want to. For example, my grandfather retired from IBM, and as part of his retirement was promised healthcare for life through United Healthcare. And about 14 years ago, they decided they weren't doing that for retirees anymore. The elderly are very, very expensive to take care of. They cost the insurance companies millions a month. And so they just dropped them. They just let it go. So the first problem is with health insurance companies and the way they're set up. They're a for-profit organization, and they are out there to pay out as little money as possible and keep that float that I talked about earlier as cash on hand, okay? The second problem is drug companies. If anybody remembers, if you don't, you can Google it. There was a guy a few years ago that got a lot of headlines named Martin Shkreli. If you just look at him, he looks like one of the shadiest dudes on the planet. What he did was he found a drug that was very cheap, but it was extremely necessary to a lot of people. So what Shkreli did was he went and bought the company and then raised the price of the drug by 4,000%. And in an interview, he said, we had a Mercedes that we were selling at the price of a Ford, so we just made it the price of something a little below a Mercedes. Well, this led to tons of public backlash because insurance companies didn't want to cover that amount of money for the medication. So they kicked it off their medication list, said this isn't covered. People couldn't afford it or they would die. And if you want to read the minutia of that story, you can, but that's the kind of problem our system leads to, is really, really bad people getting involved simply to make a profit off of somebody else's illness. The other problem that the Affordable Care Act or Obamacare helped was what's called pre-existing conditions. So if you switch jobs from company one to company two, and you came in with diabetes, before the Obamacare law, that insurance company could say, well, you have a pre-existing condition. So while other employees pay this amount, you pay this amount because you came in already sick. Well, there are some diseases that are our own fault. Diseases related to smoking, poor eating habits, things of that nature. But if you switch jobs during the middle of a pregnancy, they also kicked that out. They covered for none of the birth of your child because somehow in the world of insurance, they decided, well, being pregnant is what's called a pre-existing condition. You didn't get pregnant here. So you've got all these small, little bitty inner workings of the insurance world that just make it a disaster. And whether you love your company insurance or not, and whether you love or hate Medicare for all or universal health care, either way, you're dealing with a system that does not want to pay for what they owe you, okay? They try their damnedest not to pay it, okay? You've got the money incoming that they are sending back every month. You've got the money they're sending out in coverages for claims. And the bigger they make that gap, the more money they have for them, okay? That's problem number one with not having a universal healthcare system, okay? Number two is how do we address drug prices? So I've got in front of me an article from Fortune magazine, and this just worked for my conversation. This was actually an article on a guy who has come up with some ideas on how to treat Alzheimer's. So they just happened to drop this stat in here, but I wanted to read it to you all. Pharmaceutical companies trying to move a drug from discovery to approval phase is a daunting and expensive process. After discovery of a molecule that might have disease-altering potential, pharmaceutical companies are required by the Food and Drug Administration to vet their compound with a phase 1 clinical trial to test safety, at least one phase 2 trial to establish potential efficacy, meaning that it actually works or not, and a massive phase 3 clinical trial, often involving thousands of patients tracked over 2 or more years to verify its effectiveness, improve its safety for a wide market. The process can take a decade or even 2 and cost hundreds of millions of dollars or more. The great majority of tested compounds don't make it through. So that's the other problem that we have is companies are not willing to go down this road of solving disease problems because of the insane amount of FDA oversight. Now, as a Democrat, this is going to sound really hypocritical because I'm all for regulation, but we have an FDA that's very scared to let something out into market that might not work. If you were to talk to a cancer or an Alzheimer's patient, many of them say, I don't give a shit, let me try it. But we don't want people dropping dead due to bad drugs that these companies have come up with. So the companies are spending a boatload of money to bring to the table ideas that may or may not even work out after a decade or two. So there needs to be a way at a national level to fund research and development of drugs that would treat these diseases. And oftentimes, it's the small diseases that nobody touches. For example, Lou Gehrig's disease, there's not a single large pharmaceutical company in America on the Fortune 500 list right now that is even attempting to find a compound for that because the market is so tiny, okay? They would never make their money back. So they're just saying, fuck it, let people die. So that's kind of a problem. We need to incentivize them to go out and do the work on that so we can cure that. it's odd to me that we spent a lot of time and a lot of effort finding a compound that fixed erectile dysfunction. But what the companies knew was guys like to get laid. And if you cannot achieve an erection and we find a pill that fixes that, it will sell like crazy and we will make a lot of money. So we solved erectile dysfunction, but we haven't solved Alzheimer's or Lou Gehrig's or the common cold or certain forms of HIV and cancer, because we've just decided those we're just going to let them go by the wayside. So our entire system from the inside needs to be changed. This debate of private insurance through your company versus Medicare for all is not at all the argument, okay? No matter what, right now in America, we work in a system where every insurance company, from health to auto to home to business to RV, motorcycle, malpractice for doctors, anything you could imagine, is incentivized to bring in money from you paying for the service and paying out as little back to you when you need it as possible. That is what insurance does. And it doesn't matter what kind of insurance it is. It's just that in this debate, those of us on the left feel that health should not be something that only people who have a full-time job at a company large enough to afford to pay for it should have health care, okay? So I wouldn't mind a system where, like, the Verizons of the world continue to pay for their employees, and that's fine. But if you are part-time and can't find full-time work, or if you're working two part-time jobs, or if you switch jobs, there's a lot of loopholes that damage you as a person and make your life miserable that we don't see. And maybe for somebody like Mark, who's been at Verizon for 100 years and has never had an issue, you might worry about, well, what would a Bernie Sanders Medicare for all look like? And what would that do to the situation I'm in now? That is a fair question. What I want us thinking about, and what I would like to try to do, is get everybody thinking about the internal workings of our system, where profit over life or profit over financial ruin wins, okay? So right now, as a country, if you go bankrupt over healthcare, we don't give a shit. And right now, if you die due to lack of healthcare, we don't give a shit. So when people wear their Make America Great Again hats, I'm fine with you voting for Trump. But if you're trying to repeal the Affordable Care Act, which doesn't affect your insurance at your company at all, it's just giving insurance companies more people to go after to get as clients, then that's foolish. And you're actually saying, I want to harm people around me that may not have the luxury that I have due to whatever the circumstances may be. So we have to understand how insurance works in this country, which is a problem. We have to understand how expensive it is for drug makers to bring drugs to market and what are they treating. There is a company out there, and I can't remember, I wish I did remember the name of them, but right now it escapes me because I've been on this rant, but they've got a cure for HIV, and they cured a lot of patients last quarter. And when they told Wall Street the number of patients that they had cured of HIV, it sent their stock down. Because if they cure you, you're not a repeat customer. Once you're done taking that drug and it has cured your body of HIV, they didn't care. It was like one of the most stand-up insurance company moves of all time. They didn't care that they would never get a repeat customer. They just wanted to cure and eradicate HIV, and they found a way to do it, and they did it. So Wall Street complained, and many Wall Street analysts who follow the company said, we are concerned about your customer base going forward as you continue to cure them all. And the CEO said, then I don't give a shit. That's fine. I've cured HIV. Isn't that better for the world than if those customers ever come back or not? And those of us on the left say yes. I would even implore you that most Republicans would say, yes, curing a person from HIV is more important than company profit or insurance profit. I would say most of us could agree to that as a starting point. So this is a lot of information, but I was just trying to get to the heart of how insurance works as a whole, because it's not just your healthcare company. How drug makers operate as a whole, and what do they go after? And why is it that people like Bernie Sanders and myself and Elizabeth Warren do not like the system we have now? Because nobody is holding insurance companies accountable for this nitpicking of doctor coding and not wanting to pay. Nobody is holding people like Martin Shkreli accountable for taking a very cheap drug and realizing, wait a minute, if they don't take it, they die. I can charge whatever I want to. And then if the customer doesn't pay it, the insurance company will. And if the insurance company doesn't pay it, the customer will just die. That is a below human act, in my opinion. That doesn't even classify you as being part of the human race. We should have just executed the guy in public and moved on. But that's what our healthcare system today has led to. And to make it clear, out of 33, what did I call them earlier? Your 33 big normal nations, your industrialized nations, only one of them does this silly thing where your health insurance company is tied to the company you work for and how much that company can afford to pay out every month on your behalf. And believe me, when your costs go up, it's not because of the ACA. This has been happening since back in the 90s, okay? Every year since the mid-90s, companies have paid less and less and less for their employees' health insurance. The problem I have, and this is where I'm going to implore anybody who either dislikes Medicare for all or is a Trump supporter, I implore you to do your research and look back and understand that the problems inherent in our system today are the same problems that were inherent in it when Clinton was in office in the 90s and his wife at the time tried to fix the system, okay? This system did not start when the Affordable Care Act came out. All the Affordable Care Act did was give more insurance companies more access to more clients. That's it, okay? It has saved, the Congressional Budget Office said it has saved over $1 trillion in our economy since then due to lost payments for the uninsured. So understand that I don't have the perfect answer yet, but I would think with governments being not-for-profit, taking some of this back away from insurance companies and drug makers would be a benefit to all of us. And we're only as strong as our weakest link. And right now, working for a small business, working for a company that doesn't make a lot of money, working part-time or being unemployed automatically means you don't have a right to basic things like a dental clinic. But you have a right to get your mail every day, though you're not working. You have a right to call the cops if your home gets broken into. You have a right to call the fire department. You have a right to drive on public roadways and walk on public sidewalks and visit public parks. All of those things are things that we pay for as a whole, and then everybody just gets to use them. We are just asking that healthcare be added to that list because the underpinnings of the system with the current way that insurance companies operate and the way drug companies operate is not something that is in the best interest of the health of our country. And that's it. I don't care if you're lazy or not. I don't care if you're choosing not to work or not. I am more concerned about the overall cost of health in our country today and how do we make that something that we don't have to talk about anymore. I did research this morning, and of the 33 countries that have nationalized health care, when they look at big topics in their elections, healthcare never even tops the top 5. You're going to find complaints everywhere. One of the complaints I found is an over-desire to go to the doctor. So like if you're in France and you get the sniffles or you don't feel well, you run to the doctor because it doesn't cost anything. Yes, that's going to be a problem. But I feel like that is a much more minor problem than a woman gets pregnant working at company A, 3 months in gets offered a promotion to go to company B, and then a health insurance company says to her, I'm sorry, pregnancy is a pre-existing condition. We're not going to cover that. That is just, to me, abhorrent on a level where if we are going to try to make America great again, then we have to take care of everyone's health. And you please have to go out and study these issues. You can't just watch Fox on the right or MSNBC on the left and say, I have an answer. Because you can't have two sets of facts, okay? 2 and 2 can't equal 4 and 5, okay? So there are facts out there. You just have to understand how the underpinnings of this work. And I hope this discussion on insurance companies and the way they operate and on drug companies helps you. And I don't want it to be a flame war, and I don't want insults thrown around. I just want people to educate themselves more before they speak up on a topic. And I'm not specifically just talking about Mark. I've had this conversation with tons of Republicans who say the exact same thing, and it comes from a place of not knowing how the entire system works. So I can see the fear from Republicans when we on the left do a really shitty job of explaining this. And since I have not picked a candidate for 2020 yet, I'm going to go ahead and lay this at the feet of the man who has been championing this since his last run. And if you are a Sanders supporter, please tag him in this for me. Bernie, I implore you to get beyond saying Medicare for all, because nobody knows what the fuck you're talking about. And what you're doing is you're scaring people who have a job that are in their 30s, 40s, 50s, and 60s and have only known one thing. And you're asking them to move to something that you're not fully explaining. You're just saying it's free. And what they're wondering is what you're offering that's free going to be better than what I've got at the company I work for now? And you're doing a shit job of reaching people who are not taking the time to study these issues for whatever reason. If you continue to just say Medicare for all, then you're going to continue to have people on the right saying to kill the Affordable Care Act, even though it has not harmed a single person who has company paid for insurance, because you have done a miserable job on breaking this down to a level that people can understand and relate to. So Bernie, if you're going to keep running on this, then please, dear God, stop just saying Medicare for all. The majority of this country has willfully chosen not to investigate how the world of insurance, health, and drug companies work, and they don't know what you're saying, and they don't know what its implication is to them right now. So I implore my Bernie Sanders friends out there to please educate people around you, show them how insurance companies work, lead them to this video, and please tell Bernie that if he wants my vote, I want to see him convincing people that have paid for health insurance through their company. I want him to help them get to a place where they see that Medicare for all is not going to harm them, but leave them either whole or make them better. So hopefully somebody learned something. I only bitched at Bernie Sanders, and I bitched at the ACA because I think the first A in Affordable Care Act, it's not really affordable, but whatever. But so those of you on the left, y'all got some work to do. Bernie's got some work to do. And we as a country need to just move along with the rest of the world and make the health of our country and the betterment of our citizens' lives a basic human right, just like we have the FDA that regulates our fucking meat and our chicken McNuggets at McDonald's. That's all I'm saying. I'll talk to you guys later. Thank you very much. Bye-bye.